are live.
And we are the Coalition, loud and proud, outrage-born-free, civilly disobedient media, broadcasting live on the Worldwide Coalition Radio Network. Well, on the Worldwide Coalition Radio Network at coalitionradionetwork.com. Here we are in the bunker, based in our new location. For all intents and purposes, this is week 2 of our operations. So for those of you who have taken the time to listen, watch, participate by calling in, we are grateful. Facebook.com/The Coalition Radio, on the mighty Twitter at Coalition_radio, and of course the mothership at coalitionradio.us. We'll be updating our link soon, as currently you can watch the show live via the Facebook, our website at coalitionradionetwork.com, Periscope, as well as on our YouTube channel. And if you have a moment, if you could follow us, watch us, live us, subscribe us, whatever, we'd be grateful. Kind of a rare morning programming, as most of our standard program you'll see at the website now is dedicated at night, but we have on the line with us one of the busiest people in Rhode Island politics. A mere pandemic is not enough to slow him down. Joining us, he is a frequent offender. He's been on the show in virtually every format we've ever had, going back to our radio days, and I mean days, is Sam Bell, Rhode Island State Senator. Sam, thanks for joining us on a hectic Thursday morning.
Thank you so much for having me on.
Well, I
believe it is Wednesday.
Is it Wednesday? I can't even tell anymore. Has that happened to you yet?
I think it's Wednesday. It's possible I've gotten that one wrong, but my computer screen says Wednesday.
Well, thank you for being you. First off, how are you doing? I mean, you and you're still somewhat of a newlywed. Congratulations by that on that. I don't know if I've had a chance to say that online. And how is just day-to-day life in your world?
It is. It's all right. It's a little difficult being locked away inside and not being able to get exercise and things like that. And it is also a little difficult to not see that many other people, but I'm very lucky to have my wife with me, and I would be going very crazy if it weren't for her. So I'm very glad to have her there. Aside from that, what frustrates me most is watching the political situation. I see so many people suffering. I hear from so many constituents. I hear really horrible stories coming out of our hospitals. And our legislative leadership is doing nothing. I think it's unconscionable. And I also think we are watching the decisions being made right now that are going to lead to terrible economic underperformance, to really, Rhode Island having a much worse recession than the rest of the country. And people here don't seem to care. And for all the years of banging on about how the machine cares is all about jobs in the economy.
Right.
When we actually have a jobs and economic crisis, they just seem to totally not care at all. And so it really proves that everything people are bleeding on about jobs, the economy, about small business is all bogus. Now that we have a crisis that primarily affects smaller businesses, not larger businesses, states around the country are bending over backwards to save restaurants and small stores and things like that, where I don't seem to totally not care because these are smaller businesses and they don't have the connections and the money to buy influence at the State House. And it's quite shocking. I'm genuinely speechless with what the legislative leadership is allowing to unfold.
Now, from a couple of perspectives, first of all, Rhode Island is a state that at least the landscape that you and I deal with every day is dominated by small business. Obviously, the restaurant, retail, and travel sector have been decimated. You've got the spectacle of a number of large, by Rhode Island standards, local businesses that have been reinvesting in the economy and expanding right at the onset of this of the COVID crisis. What are you disappointed by specifically, and what would you like to see done?
Well, number one is our failure to put any money behind our public health efforts. The governor does not have the power to appropriate money. And so, she has done a decent job, I think, of issuing protective orders to keep people safe. However, she has not had the power to appropriate funds to get money to the hospitals and to make them stop laying off people, make them stop furloughing people, put every dollar that we have behind getting adequate protective equipment. And I also think, one of the things that this crisis has really revealed is that we have a very corporate hospital management that runs things on thin margins, that did not stock up enough personal protective equipment. And that kind of short-term thinking, poor decision-making, compromising public health for short-term profits by hospital management is, I think, a decision that needs to be scrutinized. And I think that we may need to start talking about changes in hospital management because of how poorly they seem to have predicted and gotten this crisis, how poorly prepared our hospitals seem to be. But when our hospitals are poorly prepared and Rhode Islanders are suffering because of that, and part of the reason, of course, our hospitals are poorly prepared is because people, primarily the governor, actually have eviscerated the funding of our healthcare sector through brutal Medicaid cuts, but also, of course, the legislature. Legislature is not blameless in that by any stretch of the imagination. And so we get to the situation, and we are not seeing the funding flow. And they need immediate state funding, and they're not getting it. California voted immediate state funding weeks ago, $1 billion for public health. And we're just not seeing those funds flow. So that, I think, is the number one most unconscionable thing. Every time you have someone without personal protective equipment or adequate personal protective equipment dealing with coronavirus patients in hospitals, they can get sick. They can then spread it to other patients. We for reasons that are, I think, genuinely shocking, we haven't set up a quarantine hospital for non-coronavirus patients. So if you have a heart attack, you have to go into a hospital for coronavirus without adequate protective equipment. It's preposterous, really. Lenny Theo, who's running for Senate District 4 against the Senate President, who's a nurse, has called for quarantined surgical centers to be set up quarantined from coronavirus, and it just seems to me shocking that hasn't happened yet. So I think the legislature needs to make sure that we treat this public health crisis seriously. The second part is people's budgets are suffering right now. People are out of work. They don't have, we let April 1st, when rent is due, come and go without any assistance to help people who are struggling to pay their rent. And a lot of people out of work with no ability to get work. We're seeing more unemployment now. I think we're up to 100,000 Rhode Islanders or more unemployed as a result of this crisis. We're, depending on how big you think the backlog is, but it's really, really bad right now. And we have done absolutely nothing. No cash assistance. No, the legislature has not waived, not even fully waived eviction. Although the courts are closed, some evictions are still going on. The legislature has not placed a moratorium on mortgage payments or rent or anything like that, or even just done any funding to tie people over, or any kind of assistance at all to help with the cash flow of Rhode Island families. We seem to just not care about the people of our state and their financial distress. And of course, as Rhode Island families face cash flow problems, it filters to the rest of the state economy. And it's all interconnected. And as families lose purchasing power, then they buy less locally, and then that hurts. It becomes a spiral, and that hurts other sectors of the economy, and more people lose work. And in order to prevent that spiral, we need to take action. And we really genuinely seem to not care. One of the decisions that the governor has made that I think is the primary reason why I'm not willing to join with all the people who've been praising her for her response. She has made a decision that I think is absolutely unconscionable. And that is the decision to freeze state hiring. We are in a jobs crisis, and math is real. And if you shut off all hiring of state jobs except for emergency hiring, then you crush the jobs market by slashing the public sector side of it at the same time. And we need to ramp up public sector staffing. We should be doubling or tripling our hiring. Freezing it instead is totally unconscionable. And it's not like it's not like the state finances wouldn't allow us to ramp up hiring. The money is very, very easily there. And it is totally unconscionable for her to make that decision. And I think that is one of those decisions that didn't get much press, but that's one of those calls that is going to mean extra economic damage for Rhode Island. And I think the way that we're going right now, we are likely to see a worse economic crisis, perhaps even than the rest of the country, despite the fact that we're in a region of the country that has a much stronger economy. And typically speaking, Rhode Island historically has been very much boosted by the Massachusetts economy. But in this case, we are not, or we may not be, and we might actually fall not just behind Massachusetts, but actually behind the country as a whole because of how poorly we're handling the economic fallout of this crisis. And I'm very worried about that. I think that the consequences of that for Rhode Island families will be horrific. And so the governor needs to immediately rescind her order and have Jonathan Wilmer, the director of OMB, start ramping up hiring instead of freezing it. That needs to happen. And the legislature needs to convene remotely and take emergency action to appropriate funds to help out families who are struggling, to appropriate funding for public health, and also to address all of the small businesses that are in danger of closure. You know, there's so many restaurants that you and I and everyone listening loves that are all going to be shut down. And not because of the fault of the restaurant workers or owners, because of this crisis that was unprecedented. Yeah, I'm working on legislation that's submitted with Representative Lombardi, who represents Federal Hill with me, to ensure that business interruption claims for business interruption insurance get paid. And many restaurant owners had business interruption insurance and are now discovering that the insurance companies are claiming, well, it doesn't cover that.
Right.
And so I'm submitting legislation to have those claims be paid. You know, that's just a small thing we can do. But it's also really important that we provide direct cash, probably, I don't know, something like $25,000 for each restaurant in Rhode Island, which the state can afford. And we need to do it, because if we don't, we're facing massive economic damage. We have to do it.
Now, interestingly enough, I was going to say the state has allegedly been apportioned approximately, I believe, $1.25 billion by the federal government. Now, to your point about the convening the House and the Senate, the legislative branch, for those folks who might have missed civics, is in fact the co-equal branch of government that's responsible for the checkbook. Have you gotten any indication from the governor or the governor's office or anybody anywhere where that money is going to be spent? Because it would seem like that, that would money be tailor-made for business assistance in this case. It seems like that was manna from heaven.
I don't think that money should go to business assistance. I think that business assistance is primarily something that is very much a short-term need, especially since the SBA assistance will take maybe a month and a half to 2 months to roll out. So business assistance is very much something that's needed now, not 3 months from now or 4 months from now, once half the restaurants in the state have already gone bankrupt, or maybe only a quarter. So I think that, and if the government, if the governor plans on doing that, then she should put out a proposal so people can budget for it. But I don't think that that's an appropriate use of business assistance, because it is really time sensitive, and to decide that we're just going to wait and let everyone fail, and whoever's still in business can maybe pick up a couple of checks. I think that that's cold-hearted. I think it's unconscionable, and I think it's a really bad decision. But more so, I think I do think the first priority should be public health, and the second priority should be workers, and business assistance should really only be the third priority. And if we're going to only bail out businesses and not do anything for workers, that would be, I think, ridiculous. So I would hope that those funds really should go to Rhode Islanders, go to people. And they should go to public health.
If you're just joining us, Sam Bell, Senator from Rhode Island, is joining us live on the line. We are the Coalition at coalitionradionetwork.com. But one of the most often, if you follow social media, and a lot of ordinary Rhode Islanders are asking the same kind of questions you are. Other than her flannel shirt moment every day at 1 o'clock, where she issues a continuing set of edicts, there doesn't seem to be a lot of, and the Commerce Corporation is going to roll out tech support on Microsoft Word. There doesn't seem to be any real plan. One of the things often questioned about, to your point about public health, is Memorial Hospital in Pawtucket. Are you aware of any plans to revive that, if even just temporarily, to respond to this?
Yeah. No. People are. I think that will happen. That's under discussion. I think it's going to happen.
Is that what's shocking to me? To your point about preparedness, is that a few years back, when the Ebola quote unquote crisis hit, there was more conversation in public life about nursing safety then, and it was a provocative question at the time, because the nurses union pointed out quite aptly that they had not been trained to the point that the PR machine in Rhode Island would have you believe, than there is now during a time when you've got a significant portion of the medical staff of hospitals in Rhode Island being potentially being exposed to what is clearly a virulent illness. And you've seen, and there's a couple of people you and I know who have been quite provocative on Facebook, pointing out specifics, not just generalities, but specifics, since they work in respiratory therapy and areas like that, about the absence of. We are a state that I used to joke about a former Secretary of Health, if you will, in Rhode Island, who had what I call pandemic envy, because he had drills all the time. Where has been, we hear mumblings about this all the time when you and I get the same press releases. It strikes me as almost criminal, the lack of preparedness. Am I overreacting?
I think that the very serious question need to be asked about the lack of preparedness, and I think that there are really two questions. One is about hospital leadership, but the second thing is that I think one of the things that this crisis has revealed is that the legislature is basically in charge of who runs hospitals. The Hospital Conversions Act allows us to essentially regulate all hospital transfers and ownership changes. And every time there's a hospital ownership change, we pass a special law to enable it, or change the rules or whatever.
Mm-hmm.
And with the Hospital Conversions Act, I think that the state really should have thought about the management of these hospitals. and they become increasingly corporate, and they become less about public service and about public health. And I think that questions should be made about the specific leadership of all of the hospitals in Rhode Island. I think that is something, a discussion that we need to have. And I think that it is worthwhile, and I know that it's an unpopular discussion to have, but I think Babineau's leadership at Lifespan, in particular, needs to be questioned. He has consistently pretended that these problems are not ongoing, while the stories coming out of Lifespan are horrific. And that kind of thing is unconscionable. And the decisions to make layoffs are ridiculous. The decisions to and the failure to adequately stock personal protective equipment, to continue nickeling and diming workers, and to not adequately protect the hospital's workforce is I think very concerning. And Lifespan has been under considerable pressure for a while because the union has, I think, some very, very well articulated concerns with the management. And, they had the largest, one of the largest strikes in Rhode Island history because of how badly they treated their workers, not providing adequate staffing, not providing adequate materials. And, that strike was a drastic action, but it was needed. And I think it's a sign of the poor management of that particular hospital. So I really do think that questions need to be made about hospital management. But beyond that, I think questions need to be asked about the leadership of the General Assembly. And I think particularly we have to remember the General Assembly approved the Fatima Hospital. The state of Rhode Island basically allowed the Fatima Hospital transfer to go forward. That, among other things, has resulted in Fatima nurses losing their pensions. It really shows that we haven't done adequate oversight. And, the next time a hospital conversions vote comes up, I'm going to work much harder to scrutinize the details behind it because, in the past, the one vote we've had, I had to recuse on because I worked at Brown at that point, and Brown was involved in the transaction. But in the future, as these things come up, I'm going to work hard to scrutinize them because the state has an obligation to ensure that hospitals be managed responsibly for public health of Rhode Island. And I do think that this crisis has revealed that there are questions that need to be asked. However, most importantly, I think we have to talk about the failure of the state legislature to take action. I think, the most ridiculous.
Let me just jump in for the hospitals for a moment. On a similar note, airlines today were proactive, probably because of SEC reporting requirements or something to that effect, of reporting the incident of infection amongst their flight staff and most importantly flight crews. And it was probably should have been expected, but the fact that hundreds of members of flight crews across America working for major airlines have fallen prey, if you will, to COVID. Is an important disclosure. Is it important at this point in time that the hospitals start to acknowledge publicly what the toll has been on hospital employees?
I really think so. Yes, they need to, and I think that the hospitals also. I think it is a failure that people don't have adequate masks and are going into contact with coronavirus patients without adequate protective equipment. That many workers have been exposed. I think that's horrifying. Mm-hmm. The stories I hear from people who work in the hospital are just horrifying. And I think that we as a state have failed when that happens. And to some degree, the shortage of personal protective equipment has to do with the hospitals failing to stockpile it. But I also think, there are questions about state leadership as well. We should have taken action. We should have appropriated money early on to deal with this crisis And if we had put, this is not, money doesn't solve every problem, but it makes everything a lot easier. And we have not taken that route.
What you mentioned you went into quite some detail about small business incentives. From regards to public health, what specifically and/or business and/or economy, what would your priorities be in terms of state intervention financially?
Well, on a technical level, I think that the Medicaid program is the right lever because of the very high match for federal dollars. So it's the best use of state money to invest in Medicaid. It always is. Medicaid is almost always the best investment we can make as a state because basically the feds pay for like 75% of it. In this case, maybe closer to 80%. So we really should ramp up our Medicaid spending, increase Medicaid reimbursement rates, and just make sure that the hospitals do not have any financial pressures on them while dealing with this. That financial stress is not part of it. Then there are other technical things that need to happen. Now, the acting Medicaid director and the new EOHHS team have done a decent job of waiving some of the horrific policies that have been put in place in the past, including they actually postponed the Medicaid purge, which was very good. But what they have not done is they have not waived the payment models. So it's very, very complicated stuff. But basically, the Raimondo administration has this plan to screw over the entire healthcare sector of the economy by messing around with how healthcare gets paid for in a way that it doesn't actually get paid for. And basically, there's this thing, the assumption of downside risk, that's scheduled for starting around July, and that is not allowed to go on right now. That should be canceled, and it has not been canceled. And so I think that they have not used their payment model tools adequately. But most importantly, the legislature has not appropriated additional Medicaid funding. And the legislature should have appropriated additional funding for the Medicaid program weeks ago, if not months ago, so that our hospitals were adequately staffed and prepared. I remember having conversations in the Senate, with other senators and saying, we need to appropriate funding. And people are like, no. But, you have to put money, if you care about something, you have to put money behind it. And we have done everything for public health except things that cost money. Because the legislature has not appropriated those funds. So we need to appropriate the funds. It costs the state very little because it's mostly federal money. We should have poured $1 billion.
What would you, anyone who follows government at all, and again, understanding the role of the legislature, it is shocking to see them essentially become wallflowers, to literally disappear before our very eyes. In fact, I would call it the incredible shrinking Rhode Island state legislature. In a time of crisis that, quite frankly, makes the RISDIC crisis almost seem mundane. This is the single largest crisis in the history of the state. There's just no doubt about it at this point. And I'm going to talk on a human level and economic level because I spend a lot of time with small business. I during my day job, which I'm laid off from, I sell to small business. I've seen firsthand the personal stress and the devastation.
Oh, I'm sorry about that. I'm sorry that you've had to go through that. That's awful.
Well, I have an outlet here, and we've been working on expanding that, and so I'm blessed. I'm blessed that I have a spouse who's working. I'm very fortunate in a lot of ways, and I see firsthand so many Rhode Islanders like you see them suffering on a level that it's horrific. So what would you ascribe to the motivation simply to disappear before our very eyes?
I think I thought a lot about this. I think it's extremist fiscal conservatism. I think that genuinely the Speaker and Senate President do not want to appropriate money for public health. They do not want to appropriate funds for Rhode Islanders who are suffering from financial distress, and they don't want to appropriate funds for small businesses. And I think they just don't want to spend the money, and they want to save the money for tax cuts for rich people, and they want to save the money for corporate welfare for politically connected developers. And that's what I really think that's the prioritization that's going on. It's the only thing that really explains it. It's not like we couldn't meet remotely. Other states are doing it. So I think it has to be ideology. Ideology is the only thing that explains it. It's that these, Republicans at the national level, at least, have never actually believed in fiscal conservatism. They've understood that it's a sham, that it's a tool to be trotted out whenever Democrats are in power to argue against social programs, but that actually fiscal conservatism, logic undermining it, is totally bogus. And they've understood that. And I think most Republican politicians deep down, while they may argue about things around debts and deficits, understand that fiscal conservatism is something for political rhetoric, but actually the logic undermining it and the economics behind it are totally bogus. And obviously, the legislature, there's plenty of money to go around, and we always have the capacity to afford nice things. And the state is more limited because, of course, the state can't print money, unlike the feds. But at the same time, we are being backed up by the Federal Reserve buying our bonds, which puts us in a situation somewhat similar to the federal government. So because the feds are buying our bonds, the Fed is buying our bonds. Because of that, we do have real capacity to spend right now. And so, the economics behind this fiscal conservatism logic are not real. And Republicans, I think, generally, although they would never admit it publicly, understand that on a deeper level. But I think that the hardcore right-wing machine folks who run the Rhode Island General Assembly, Senate President Dominic Ruggiero and House Speaker Nick Mattiello, have drunk the Kool-Aid on fiscal conservatism and want to do a bunch of brutal spending cuts and eviscerate state agencies. And I think that they want to come in, have waited out the crisis, so there's no need to spend money on addressing this crisis. They want to wait until the storm is over and it's too late to appropriate money for public health, and it's too late to appropriate money to bail out small businesses. It's too late to appropriate money to tide people over, and then throw out a little bit of the federal money that we got to deal with some of the post-fallout of the crisis once it's a bit late. But mostly they want to have an excuse to go in and just slash all of the social programs. And I think that has to be the logic undermining all of it. It has to be the logic. It's the only thing that really makes sense.
You know how
go
ahead. I'm sorry.
I just have to think that underlying all of it, as the Senate president has decided that he wants to sit at home taking care of, I think it's his daughter's dog, maybe. And that I just have to think he doesn't care. I really think he just personally does not care. And if he cared, then he would use some of the many tools available to him to lessen the suffering of Rhode Islanders. And I really think that this is just yet another moment where we have to question his leadership. And I think that we have to hold accountable everyone who voted for him and continues to support him. And the same is true of Nick Mattiello, although I don't think Mattiello is quite as problematic a figure as Ruggiero. But still, Mattiello is still not a great speaker. And I really think we really need to question their leadership. And we're coming up. We will have primary elections, and I really think Rhode Island Democrats should vote out the people who support the Senate President and the House Speaker. And if people still support them, I do think that there's a real opportunity for a lot of people to drop their support from this leadership team, because this leadership team has done such a terrible job, and the failure is all around us.
Now, you and I, you know how I feel about the Commerce Corporation here in Rhode Island. I continue to be frustrated at their insistence on now working into the budgets all sorts of corporate welfare to aid developers in questionable projects, and meanwhile, this with quite frankly a poor success rate. What should the role, if any, of the Commerce Corporation be in your mind in reacting to this crisis?
Well, they're the only part of the executive branch that really sits on almost infinite power to spend money and appropriate money to bail out businesses. Through their TIF program, they can take out an unlimited bond and give unlimited cash for basically whatever they want, especially with using executive actions to loosen any restrictions in that law. They have the power to do basically whatever they want. So I think what they should do is they should provide cash to businesses on the assumption that those businesses rehire their workers. And they should do this immediately. I know that there are timelines about issuing bonds, but the state has a large line of credit and has liquidity and can, in fact, provide short-term upfront bridge lending to address the timelines of issuing a larger revenue bond. And I think that they should issue a revenue bond and do this. And they should do it now and not in 3 or 4 months, because businesses need the money, next week. And they really need it weeks ago. They should have done this weeks ago, and it's not too late. And they should issue, probably we're talking about something on the order of $25,000 to $50,000 for each restaurant in Rhode Island. Mm-hmm. And that I think would enable people to rehire their workforce and tide them over financially and pay their bills during the duration of this crisis. And I think that the benefits of that would flow throughout the rest of the economy. So I think we need to do that. And I think that, maybe it should be expanded to other businesses and other sectors that have been hurt. And they should get additional state assistance to patch what the SBA won't do. The SBA loans they're not coming through in a timely manner. And so the state needs to step in and do this faster. And the Commerce Corporation has the power to do so, and they have failed to do so. And I think that we have to ask questions about the leadership of Stephen Pryor. He has done nothing. And it's probably not the first time I've called for him to go, but I think he needs to go. I think that to watch the state slide into an economic depression while Pryor has the ability to mitigate it and he has chosen not to is unconscionable for someone whose job it is to secure the future of the Rhode Island economy. And so I really think he needs to go.
Do you think, and there are many right now, and again, the lack of leadership, the lack of a vision, I'll say, precipitates a lot of Monday morning quarterbacking, a lot of criticism, in the absence of really any sort of cohesive approach. The government's failure to react, as you pointed out, has been horrific. At the same time, a lot of questions have come in to affect, about civil liberties. And in your opinion, number one, I love your reaction to how civil liberties have been handled during this period of time. And number two, has the government's sort of herky-jerky approach increased the severity of the crisis to small businesses while at the same time impacting civil liberties in a way that is disproportionate to the threat? Or do you think it's proportionate? Do you think she's on the right target?
I think that the governor got a little over her skis with the New York order, and she backed down on that. I'll give her, it was a mistake, but I will give her credit for backing down after she was sued or threatened with a lawsuit in the state of New York. So, certainly some civil liberties have been trampled on. I don't think the governor has handled that particular portion perfectly, but I do think in general she was right to issue strong guidance around public health. And I think that these were necessary restrictions to place to shut down parts of the economy. And I think that she was right to act in I wouldn't say the fastest manner, but in a reasonably decently fast manner. But one of the things I think that's not often discussed as part of this is that I think this crisis has really revealed the difference between the good directors and the bad directors in the Raimondo administration. And what we have seen, is kind of predictable, where the bad directors have performed badly and things under the better directors have performed much better. Stephen Pryor and the universe under him has been an absolute failure. And I also think, it's raised a lot of interesting questions for me about the leadership of Scott Jensen at DLT. I've been very upset, obviously, with DLT's failure to protect the workers in the unemployment insurance unit, having them continue to go into work, not social distancing, not working from home. I think that that's ridiculous. And I think that while the workers do a good job, there are real management questions that need to be asked about the Department of Labor and Training. And so I'm very much interested in posing and digging into some of those questions. And I'm going to work after this crisis to try and apply additional scrutiny to that department, because it's had a lot of concerning aspects coming out of it. I haven't really dug into the details, but I think it's really raised a lot of interesting question marks about that particular department. And I think you look at the director of the Department of Health, who's always been one of the best directors in the Raimondo administration, has, I think, done a really good job. I think that you see a lot of some of the new leadership at EOHHS, Director Jones, Director Hawkins at DHS. They've really taken adequate action and actually really taken action to help people using their programs. And they stayed out of the news, but partially they stayed out of the news because they're doing a good job. And I think that, one of the really important things that's happened is that acting Medicaid director, Ben Schaffer, is in place. If we were facing this crisis with Patrick Tighe, the former insurance company executive, and actually an executive at one of the worst insurance companies in Rhode Island, insurance company, whose whole business model is privatized Medicaid, possibly one of the worst people you could possibly put in charge of Medicaid. When Patrick Tighe was involved in Medicaid, it was horrific. The purges were done with such viciousness. It was just awful. But there's a new acting director, Ben Schaffer, and he really has not been as bad as Patrick Tighe. And because he's currently there at the Medicaid office, we have not, instead of Patrick Tighe, we have not seen the Medicaid office be such a grim reaper of viciousness. And they've taken a lot of the necessary action. Not all of it, but they've taken some of it. And I think this crisis, has highlighted some of the management issues with some of these agencies. And I also think, one of the interesting departments that this crisis really highlighted is DEM. One of the things that is really important about this crisis is that Rhode Island has a very high asthma crisis, and that puts a lot of Rhode Islanders disproportionately at risk for coronavirus. And that crisis does have a lot to do with Janet Coit and her failure to adequately regulate pollution, including air pollution. And, she is very much has started out actually as an environmental activist. Is really I think a classic case of someone who starts out with good intentions but joins the government and gets corrupted by Rhode Island's extremist right-wing machine and is really flipped around and gone over to the dark side. And her leadership at DEM has put Rhode Islanders in special jeopardy for this crisis. And I think that also the closure of the state parks was not handled well. I think that it's actually not as dangerous to go for a hike in a remote part of the state away from other people as it is to go walking around the block. where you run into people all the time.
I'd like to note that they have kept the golf courses open, which I find fascinating. Other than certain Providence public golf courses, so I agree with you. I'm not sure where the disparity is.
Yeah, I think that we don't want. If it were summertime, we wouldn't want people crowding on the beach. But if you go for a hike in a remote part of Rhode Island, and it's not like Rhode Island's parks are, particularly nice. I think Janet Craig has done a horrible job maintaining state parks. It's one of the reasons why I really think she needs to go and why I voted against her. Her the only senator to vote against her confirmation. It's a vote I continue to be very proud of. It's one of those votes that I look back on and it just looks better and better every day. Right. But as she's totally allowed the state parks to fall to pieces, and really and really detailed and in the weeds ways has really obstructed efforts to fix the state parks. To the point of like giving away $35 million of her bond money that she had refused to spend, and then refusing to spend bond money the voters approved, and then giving it for years, and then giving it to Rhode. Really, really aggressive obstruction. And then, there was a whole report that came out absolutely trashing the state of the state parks. And it put in place bare minimum staffing suggestions, and she suggested way less than that. Also DEM, continues to pay workers minimum wage, which we really shouldn't do for a lot of these really, really important jobs in our state parks. So it has been one of the most dysfunctional, mismanaged parts of state government for a long time. The press doesn't really cover it, but it's been really bad. So it's not like there are any staff in the park who need to be protected. The park staffing is so low. There are some park staff, but we're talking very few. And so it's not like, there are huge concerns on the staffing side. I really think that closing the state parks did not make sense. Closing certain highly trafficked state parks, perhaps, but people should be able to go for a hike in the woods. And I think it would be a lot safer. My wife and I often will go, just to get out of the house, we'll walk around the block. But it would be a lot safer if we could get in the car and drive, to a state park and go for a walk in the woods where we wouldn't see other people.
Right, and I think it would also be a lot healthier from a mental health perspective. We're reaching now to a point where we haven't gone before, which is to effectively lock up, and people are out driving around, so I don't want to seem like they're incarcerated, but we're going in directions we haven't gone before as a civil society here. In generations.
Yeah, I think we should talk about the prison as well. The conditions in the prison are not great. And the governor has never issued any pardons, as far as I'm aware. Now, in Rhode Island, unfortunately, pardons require advice and consent of the Senate, but she should issue pardons, and the Senate should convene remotely to approve those pardons. She has the power to there are a lot of people in the prison who really don't need to be in the prison right now. And we should consider slimming down the prison population. We always should have considered this, and we should have taken more action on it. Incarceration is
particularly nonviolent crimes.
Really not the right solution.
Yeah, particularly nonviolent crimes.
Even with violent crimes, to be perfectly honest, we over-incarcerate for violent crimes as well. And that might be controversial, but if you commit one violent crime, you really shouldn't do it. It's really bad, and for certain violent crimes, you definitely deserve to go to jail. I just don't think you deserve to go to jail for as long as we lock people up for.
In a sense, if I can reflect back for a few minutes here, what this situation has brought into a spotlight, if I'm reading it correctly, and by the way, I'm right. I agree with you. I think that the sentencing guidelines need to be reevaluated. in terms of.
Well, we don't have sentencing guidelines in Rhode Island, actually.
Well, that's it was kind of going in that direction. Yeah.
It's an interesting. It is an interesting part of the judiciary that we actually have no sentencing guidelines for state crimes. And it's one of the policy things I would like to change eventually in the state. But I think we really do need sentencing guidelines because we have a lot of capricious judges who just lock people up based on their own whims. And it's much better if we have standards, and it makes a fairer justice system.
Well,
but anyway, sorry.
No, what I was getting at though is no, fine. It's what we've gone through is really a recipe, a post-mortem or pre-post-mortem analysis of just in how many ways. And I say that I'm going to say this carefully because I don't want to get into the and we don't do this on this show. We don't get into the Rhode Island government sucks. We just don't go down that road. If Rhode Island government sucks, you need to. If you're going to say that, you need to provide an analysis specifically of why you feel that way. But what we've created here is sort of a laundry list of post-mortem analysis that needs to take place literally on just about every aspect of Rhode Island government. It's kind of breathtaking when you step back and you look at the sheer totality of questionable behavior, lack of courage, and just operational failure.
Well, some areas have done well. I do think that, EOHHS and things that fall under Director Jones have mostly been run well. The health department has done a good job. I think that Human Services Department has done a good job. I think that the Medicaid office may not have done everything I would have liked, but has at least been much better than it would have been under Patrick Tighe. So some of the departments have done a relatively okay job. But it hasn't been all mismanagement, and I don't want to over-exaggerate there. But I do think that certain areas, certain steps need to be taken. I would say that the single worst problems come from OMB and on the financial side. Both, it's really the biggest problems are all about the money. The legislature won't appropriate the needed funds. Office of Management and Budget has decided to impose additional economic pain on the jobs market out of basically pure spite. There's no defense of that decision. You have Commerce who just seems to not care, just really does not care. And so all the money issues are where the real problems lie.
Interesting.
And that's often the case.
Well, now let me ask you a question here. If the state routinely portrays itself in being in a structural deficit, yet you would claim that the money is there. Is it a reassessment of the state's values? Give folks some perspective on that, because that's a controversial statement in and of itself.
Oh, well, so the state's financial picture is interesting, actually. What we have, our biggest problem is that we have massive pension debts. And our pension debts are very real, and they're very large, and we need to address them. What we don't have is very much general obligation bond debt, sort of traditional straight-up debt. And that's really the state's opportunity. The state has bent over backwards to borrow money in the most convoluted, expensive ways to avoid voter approval. And we don't even have many of the cheaper bond mechanisms that avoid voter approval either. We tend to opt for a lot of the more expensive options. So what we've been doing is setting up. There's been this sort of picture that the state has endless structural deficit. That's true. But on the capital side, we really have quite a bit of bonding capacity. And the state really has the ability to take out quite a lot of money in general obligation bonds. And because this is a bonding year, it means that we really don't face much in the way of capital constraints. We actually are not a balanced budget state. Although many people, smart people, portray Rhode Island as and say Rhode Island's balanced, we actually have no balanced budget requirement in the state constitution. We just have a voter approval requirement for general obligation bonds. But there's nothing stopping Rhode Island from having a budget that's not balanced. I'm not suggesting we should do that, but we actually don't have a balanced budget requirement. On top of that, we slashed taxes for rich people, and we did it at an idiotic time. We did it right during the implementation, right during the ramp up to the Great Recession from 2006 to 2010. But we could repeal the tax cuts for the rich. We don't have to have that. And that would free up quite a lot of funds. And if we repeal the tax cuts for the rich, the state budget would be in much better shape.
How do you respond if you will, to there are folks who will argue, and now we've had a few years of it statistically, that tax cuts to the rich spur spending and spur economic investment, spur economic activity. I was going to say, what is your specific response to that argument?
Well, empirically, right after we did this, Rhode Island faced a much worse economic crisis than the rest of the country, because to pay for the tax cuts for the rich, we slashed spending on programs that actually help people and actually do stimulate the economy, which mostly means a big chunk of that money goes to the feds, whereas most of our spending programs bring in free federal money. And so we wound up the empirical data show that the Rhode Island economy drastically underperformed right after this decision. So you might argue, that wasn't the reason, but certainly the empirical data show that that's what happened in practice. And that is what all of the economic theory predicts would happen, and it's what happened. So, there's no reason why, you get the idea that the money is going to trickle down, especially mostly rich people just sit on their money. And if they do invest it, they won't invest it in the state. Whereas more low-income people tend to spend their money more locally and don't just sit on their money because they face strapped budgets. And, when you give the money to rich people, so the tax cuts for the rich, actually a very large percentage of that, depends a little bit on how you do the math, but it's something around range of about 30%. Goes back to the federal government because of the way that the SALT deduction works. Mm-hmm. And that's a little bit in the weeds, but you even don't get all those funds flowing to rich people. Whereas typically speaking, when you make government spending, a very large, depending on the program, but in many cases, very large percentage of the spending, sometimes as much as 2 to 1, comes from sets. So additional money flows into the state. And a lot of government spending is actually mostly done with free federal money, not with Rhode Island taxpayer money. And it's often not well understood. But on top of that, you get higher multiplier effects from helping poor people than helping rich people. So really, tax cuts for the rich, if you didn't pay for them with spending cuts, they might stimulate the economy in a very, very inefficient way. But in practice, when we pay for them with spending cuts or higher taxes on more low-income people, then they hurt the economy.
If you're just joining us, Sam Bell has joined us this morning. He, of course, is the provocative state senator. This in his first term, I believe. Still,
Mm-hmm.
If you're a caller, we've got a couple callers on the line. Because of the way we brought Sam Bell on this morning, we can't bring callers in to ask questions as we normally could. So just bear with us if you can hang out there, and we'll be certainly happy to take your call shortly. Sam, number one, are you going to run for re-election again?
I am. Yeah.
Okay. Number two, I'd be interested, since you spend so much time in analysis as opposed to just commentary. The state has had a continuing reliance on gaming money. gambling, lottery, whatever.
Yes, very true.
And it clearly exposed its importance during this period of time where we had to cut down a significant portion of that, which was casino gaming, because of social distancing.
Which I think is good. I think it's good for the state that Twin River is shut down right now. That, I think, is one upside of this.
I personally think it's good if we shut down Twin River, period. But what are your thoughts on that? Is there are we going to be as more reliant than ever now because of the financial issues the state's facing, or do we actually take a moment to explore the impact of gaming on the state's economy, which I believe personally is negative?
I do think it's negative. I don't think we should. I think gambling should not be illegal, and I think that we should have legalized gambling. But it needs to be well regulated, and it needs to be handled properly. And we have the kind of gambling that we have in Rhode Island is not Las Vegas style entertainment gambling. It's gambling that is very much targeted at low income people, targeted at problem gamblers.
Right.
We're very slot machines heavy, and slot machines mostly just go after people with gambling addiction. I think it is. You might see pictures of people smiling at slot machines, but in real life, whenever I've seen someone at a slot machine, they've never been smiling. It is a miserable thing, and it's a addictive process that strips people of their money, and they get liens on their home, so I think that we need to rethink how we approach gambling in Rhode Island, and we need to take more of a Las Vegas style entertainment gambling approach, which to some degree is what Massachusetts is taking. We want the casinos should be places where the focus is not on slot machines, and where the focus is actually as entertainment centers. And that should be how we should reimagine gambling in our state. And as a result of that, we should make sure that slot machines are regulated tightly to have good payback. So, we need to make sure that we have regulations that mean that at least about 95% of the money does get paid out, and that the profit margin is only about 5%.
Mm-hmm.
And that's something that we should put in place. Now, that would obviously limit the amount of revenue that comes out of Twin River, but we should make sure that we're not just stealing cash from Rhode Island. And we also, I think, it's unconstitutional for this too much of gambling to be operated by private companies. The Constitution does say that the lottery needs to be state operated. And I think the degree of privatization is currently unconstitutional. So we need to make sure that more of it is state operated. And, I think that we should not focus on having the most addictive machines on the gambling floor. One of the real fight between IGT and Twin River was really about about how addictive the machines on the gambling floor would be. And IGT wanted a monopoly over the floor, where they would put in basically because IGT controls it, and IGT's machines are not as addictive as some of these other companies. IGT, when they had a monopoly, they would wind up with less addictive machines on the floor. So basically, the way this deal was set up, we're going to wind up putting a lot more addictive machines on the floor, and so the gambling floor is going to rip even more money away from Rhode Island families. And I think that that's a bad idea. So I hope that we don't pass this deal this year. I hope that it waits and we get a new legislature that can give it more scrutiny. Voted in September.
I agree with you 100%. I'm not sure, unless you're sort of a government wonk, I'm not sure if folks really understand the degree with which brain sciences, neurology are actually implemented, research from them are implemented in the design of a lot of these video lottery machines. A number of these professors, particularly the studies been done up at MIT, which refer to them literally as video crack. And you're right, it is geared specifically, quite cynically, I believe, towards a particular portion of the economy. And to your point, the first picture, the first time I see a group of happy upscale white people in a casino, as drinking Moet and all that, it'll be the first time. It's geared towards folks who have economic challenges. It's geared as a potential solution to bring you to the American dream. And quite frankly, one person I'm happy to see resign or retire from government was the head of the lottery. I didn't get a chance. He didn't do the talk radio circuit, or I would have congratulated him for a generation of separating old people from their pensions and creating a generation of hopeless addicts. Because I don't think Rhode Island has got much to be proud of. But that's my point.
Yeah, no, I think that's absolutely right. And there's this at the State House, we use this awful term to refer to these machines as high performing. But that high performance is money that's sucked out of struggling families, and I really think people at the State House, when I bring up these concerns, people often are like, they kind of laugh it off. And years ago, the main concerns about gambling had to do with concerns like these. But now the conversation is just about how much money we can suck out. And nobody seems to be thinking about the people of Rhode Island who get hurt by this process.
I also believe they don't consider the multiplier. You spoke earlier about the multiplier effect of a variety of spending initiatives. It's been my contention, and the contention of economics that I've read, is that these are horrible with regard to the multiplier effect, which is simplistically a way of how often money spent in a community regenerates additional spending within that same community. You could call, particularly since Twin River is essentially becoming an out-of-state entity as it continues to invest, ironically, working-class Rhode Islanders' money in purchasing casinos out of state, one could argue that there's a significant deal of capital flight taking place every time someone walks into a casino.
Yeah. Well, and even the extent that the money flows back to the state of Rhode Island, it's still money coming from people who are really struggling, and gambling profits are just. It is very profitable, and we make a lot of money off of it. But I just don't think that makes it acceptable. I don't think we should shut down gambling, but we need to I don't even think we should ban slot machines, but we shouldn't have so many slot machines, and we should have our slot machines not be the really addictive ones, and we should make sure that they're all capped at something like 95% payouts. And we should make sure that the focus of the casinos is not on the slot machines. We should make sure that the focus of the casinos is not even just on table games, but on entertainment. And, if you go to Las Vegas, a lot of it is about the restaurants and the shows and things like that.
Well, the other difference is Vegas has seen now that generationally, and even quite frankly, the Connecticut folks, the sovereign nations in Connecticut have come to understand that generationally, casino gaming is evolving, and that's a polite word for starting to go away. I mean, the folks are a little bit better at math now, and I think they understand generationally more the big lie. They'll spend money at the tables, but they're as much interested in going to nightclubs and dinners, and that's why you've seen in more professionally run organizations, they've taken floor space away from slot machines and put it into very high-end entertainment facilities. And I'm not talking about third-rate rock bands from the 70s, and I'm not talking about incorporating hotels, in the case of Lincoln, which designs of which were put in place specifically to give some protection to hoteliers in Providence. It just seems to be awfully a one-way direction throughout this entire process.
Well, I also think I think we need to make sure that we have more complete unionization, and I think we need to make sure that we shut down the Tiverton Casino. The Tiverton Casino needs to go, and the Tiverton Casino is targeted directly at low-income people, and a lot of them do live in Fall River. But the reality is that people who live in Massachusetts are people too. And, maybe I'm biased because I immigrated to Rhode Island from Massachusetts, but.
But to your point too, I mean, we have this continued insistence that there's a Massachusetts economy and there's a Rhode Island economy. Sam, that simply economics don't respect borders. Economics, I mean, the Fall River economy can be argued is as important in some cases to the overall Rhode Island economy as is, say, Stonington, Connecticut, or New London, Connecticut. I mean, the South Shore, and particularly if you go north into the Attleboro's up north, the Massachusetts economy. I had the opportunity to be on a Lively Experiment a few months ago, and I would love to see, if we actually did economic research in this state, someone do an analysis of the impact of the latest version of the Massachusetts Miracle on the Rhode Island economy. And it's actually pretty easy. All you have to do is stand at the intersection of 295 and 95 when we're not in the middle of a pandemic and watch the traffic jam of Rhode Islanders heading north to the Promised Land. I feel we would be in significantly worse climes, if you will, pre-corona, if in fact Massachusetts wasn't such an economic hotbed.
I mean, one of the striking things about Rhode Island's economic mismanagement is that we've been able to do this even while we've been able to mismanage things so badly, even while we're boosted by growth regionally. And that's one of the things. And really, you look at Rhode Island's jobs numbers and our housing numbers, things like that. You look at Rhode Island's big economic numbers. They track really closely with Massachusetts. They do so, but really until about 10, 15 years ago when they start deviating. And they start deviating really when we put in place very right-wing economic policies in Rhode Island, really extremist right-wing economic policies. And one of the things that I think is most important about what happens this year at the State House. They're making clear that we are going to come back, and we're probably going to come back in person, which I think is a bad idea, but it is what it is. We're probably going to come back in person, maybe in June. They're going to ram through a bunch of bad legislation, including the budget. And what they're going to do with the budget is I think the big question is, are we going to eviscerate the state economy in this budget? And are we going to slash jobs from the public sector? Are we going to refuse to pour funds into the private sector to stabilize it? And if we make bad choices, which I think we're going to make bad choices, the state's going to be absolutely a lot of people's lives are really going to be hurt. So I think that's really the important question. And we're going to see how that shakes out. But
I was going to say, well, Sam, I mean, I'm so grateful you took all this time to join us today. I hope you'll make this a regular stop in terms of your ongoing representation of Providence.
Oh, yeah, I'm very happy to come back, and thank you so much for having me on. I have a lot of emails to get to today.
Right.
I have a massive backlog, and I do apologize if you're one of my constituents and I haven't gotten back to you yet and you're listening. I do get back to everyone. I have just fallen unusually behind right now, but I will get back to you.
Well, it's these are challenging times. There's there are a lot of moving parts to follow in a place like Rhode Island, given its political culture. And again, the opportunity here is that you can hold forth without interruption, without commercial interruption, and that's an important part of the coalition's move forward as we kind of gradually move into a full-time, if you will, news/commentary organization as we try to grow into that. So whether it be video shows or continuing conversations like this. Hopefully, once the veil of Corona lifts, we'll start to have roundtables here. And I'd love to have your participation in that, because what the conversation I want to have online here at the Coalition Talk Radio is to have you and a representative of the right wing, if you will, to have a back and forth. I have what I've always found fascinating, and I've even during the times I filled in for Tara Granhan back in WPRO a few years back. What I've always found fascinating is that when I've had you on in environments that would allow call-ins, very few people have taken the opportunity to come in and challenge your perspective. So I want to set that up where it's a productive environment. We're not looking for to hurl stuff back.
I think we don't have enough debate in the Rhode Island media, and I'd be happy to debate anyone. And I also think it might be worth having. I think the real debate that we need to have is between there are a lot of legislators. There are a lot of people who are more mainstream. Not mainstream is wrong. There are a lot of people who go along with the leadership, but understand on a certain level that the leadership is bad, but still vote to support them. And those are the people I really think we need to have a debate with, and whose position really needs to be debated in public. There are a lot of good, and these are mostly good people. They're good people. They have good intentions, but I think that they've made a poor strategic choice by thinking that by supporting this leadership, either the Senate leadership or the House leadership. I think supporting the Senate leadership is more indefensible than supporting the House leadership, but I really don't think anyone should support either Mattiello or Ruggiero. And people who support these leadership teams really should, I think, have to defend in public their reasoning about why it's necessary to support these teams so they can, quote, get more done or whatever. Well, they understand that there are problems with these teams, on a deeper level, and don't support their ideology. Why they are supporting leadership that goes against everything they believe in. And I think people need to defend that.
No, I agree with you. They need to do it publicly. I'm sorry, go ahead.
And the Senate, interestingly, has very few true hardcore conservatives. Just about every Democrat in the Senate is to the left of the leadership. Really, with almost no exceptions. Maybe Mark McKinney might be an exception. But they're almost all to the left of Ruggiero and McCaffrey. The only person you could really make a case as more of an extremist right-wing Democrat than Ruggiero, I think, would be McCaffrey. Even Harold Metz, whose social conservatism is extreme. And I really think, his anti-vax views, I really think right now definitely deserve more scrutiny. But Harold Metz is not as conservative as a lot of these folks. He is still on some economic issues a Democrat. So most people in the Senate are just nowhere near as ideologically extremist right wing as the leadership, but they all support the leadership. Senator Nesselbush and I voted against the leadership, but pretty much all the rest of the Democrats, and of course all the Republicans, voted for them. And I also think questions need to be asked to the Republicans about why they support, the Democratic machine. A lot of them campaign against the machine. And I say this mostly about the Senate Republicans, not the House Republicans. A lot of them campaign against the machine, but wind up voting for them.
Right.
And I think they need to defend that position.
Well, it's the responsibility of the media as well to foster conversation, to shine, to employ the best cliche ever, to shine the light into the corners. I don't know that outside of the independent media world, we have much, I'll call it established media that's really interested in doing a lot of that. You're sure you've got some great investigative reporting at Channel 12 by some people who are going after, I'll call it scandal. But when it comes to philosophical questions, the conventional establishment media gives very, very little bandwidth to that. And so it's up to this sort of group of individuals, people like Steve Alquist, for example, who are all over the place, trying to write, trying to cover.
Steve is fantastic.
Rhode Islanders need to understand that, particularly in the Senate, and this was particularly appalling about the Rhode Island Senate. I don't have numbers to prove this, but I'll just throw this out there, that there is more video coverage of hearings by Steve Alquist than by the Senate itself.
That's not quite true, but
I think you get the spirit. I think you get the spirit of it. I mean, I've been into too many of these closed, little conference room style meetings, upstairs where they're discussing major issues, and Steve's there with the camera, and where are you guys filming this for Capitol TV? No, why not? Somehow amongst the egregious Senate and House budget, the operations budget, which we all got to know a little bit about, thanks to the efficacy in which black mold was removed from the House offices. You can't, in the age of Zoom, you can't install video cameras. It's ridiculous. So again, if it's not for people like Steve and indie media, I would argue that there'd be little or no coverage at all of any of the philosophy, the inner workings, the internal debates, which are critical.
Yeah. No, and we definitely need more video coverage of the amount of times I've had a hearing, and I've grilled people, and we've had people. That's a really interesting committee hearings. I sit on Commerce and Housing and Municipal Government, and they're just never videotaped. So we've had really interesting hearings, and when I sit there, a lot of times I would love to have the video, and we just don't have it. And people make commitments in these hearings that they haven't followed through on, and because we don't have the video, it's hard to hold people accountable. But I do have to run because I have a bunch of emails to do, and it's Passover, and we have a lot of cooking to do. So.
Well, listen, I have a wonderful celebration of Passover this week, and again, thank you, Sam, for spending so much time with us. I look forward to having you on again.
And thank you so much for having me on.
Well, this was great. This is what I hope the future portends. A kind of exhaustive coverage. All right, buddy.
Okay. All right. You stay safe and have a great rest of your week.
Thank you very much, Sam Bell.
Okay. Bye bye.
Dialing in, if you will, as a senator from Providence. Sam is viewed, I'm sure, by many in Halitosis Hall. All credit to Rudy Jeeks for being an obstructionist. We credit him, despite some philosophical difference he and I may have. We credit him for being a voice up there that's willing to challenge, willing to make the unpopular votes. We lost. We had a couple of people calling in. It's if you'd like to take a moment and call back, we'd appreciate it. And we brought Sam in via telephone because of some Chrome issues in terms of bringing him online. So I didn't have the opportunity to phase people in. But we are the Coalition, loud and proud, outrage porn-free, civilly disobedient media, broadcasting live on the Worldwide Coalition Radio Network here, at the Worldwide Coalition Radio Network.com. Here in the bunker at an undisclosed location, deep in the heart of the city we love, Providence, Rhode Island, the naked city, the city of, as we say at nighttime, about 300,000 plus stories. We just heard one of the most provocative ones. Pretty wide-ranging conversation there, ranging from not even obliquely calling out and questioning the leadership of Dr. Babineau, I believe it is, from Lifespan. Hope I got that right. And, of course, someone who certainly we're not on the Thanksgiving supper list here at the Coalition. That, of course, is Stephen Pryor from the Commerce Corporation. This and any and all shows can be heard, if you will, live at our website, coalitionradionetwork.com. We've got a list up of today and tomorrow's entertainment. There is at times a libertarian bent in terms of some of the guests that we have come on. Full disclosure, I am involved in the Libertarian Party of Rhode Island. I also am involved at the national level with the Libertarian Party. Those efforts, I want to be clear, are always independent here. Any comments here are not reflective of Libertarian party per se, although one of the other challenges of hosting a show like this is to have whether you want to get into an argument or question or challenge. The approach of this show has and always will be to have conversations. I'm interested in hearing someone like Sam Bell develop his thoughts, be able to speak at length to certain issues without an overbearing host, without commercial interruption, without devolving into the sort of screaming head programs that are so popular and so prevalent on the talking head stations, on the CNNs, the Fox Newses of the world. I don't know. Maybe that probably cost us listenership because there seems to be a cult-like attraction to that. But that's simply not how we do things here. We'd like to elevate the art of conversation. We in our new facility, once the pall, if you will, of this virus, this disease is lifted, we will be looking forward to panel-style conversations and mixing it up a little bit more with folks of opposing viewpoints. But again, as our opening line always says, we are outrage porn free. What does that mean? Well, we do cover exhaustively civil rights within members of the adult entertainment community, so we're not exactly porn free. But when I talk about outrage porn, we're talking about issues that are ginned up to dive at the emotions of people, to engage in what someone I admire a lot in the radio business, a gentleman by the name of Maverick, who was the longtime producer for the Matt Allen radio show. Operation Change the Subject. Because if you're arguing about nonsense and emotional issues, and so much of it devolves into nonsense, then you're not having a real conversation about leadership within a host of state agencies that most folks will never actually engage with, yet disproportionately the impact the quality of life and have budgetary influence over the state of Rhode Island. Personally, I'd rather focus on that. That may make us a little wonkish for some tastes, a little bit more in the weeds for other tastes, but it's not being covered. And these are, as it turns out today, life and death issues. For a state that was so obsessed with emergency preparedness under former health director and former gubernatorial administrations, what happened here? Why isn't the state having a more honest conversation about the impact of this virus and this crisis on the day-to-day lives and, quite frankly, the health and safety of some of the most hardest working people in the state? And I'm talking about healthcare workers. And I'm talking about every level, not just physicians. Respiratory therapists, CNAs, nurses, attendants, security. All of them are at risk during a period of time like this. I've gotten to, through other organizations I've been involved in, I've gotten to meet a lot of those folks. And we're talking about folks who are sincere, dedicated professionals who work very, very hard at jobs that are often not, to use the governor's term, well-paying. These are not jobs, in many cases, that are going to launch you into the middle class. Many of these jobs are paid at a subsistence level. And yet there they are every day in environments like this. I mean, hey, listen, if you've ever been to Rhode Island Hospital at night, you know on a Saturday night, you know how challenging it can be, particularly with the closure of Memorial Hospital in Pawtucket. So you have more and more patients of violence, if you will, being forced into Miriam and into Rhode Island Hospital. How does that work? And why hasn't there been a more aggressive move to redeploy the assets at Memorial Hospital? Why haven't, I'm a libertarian, why haven't private companies been invited in to bid for the property and to put together some type of solution? I mean, there seems to be an absence of imagination there. Why haven't facilities been more forthcoming? I mean, we're looking at hotels being taken over with cots. as if that's going to be able to support a high-stress medical environment, the likes of which Corona demands. So we're going to take a quick break right now. Again, we are the Coalition, loud and proud, outrage porn-free, civilly disobedient media, broadcasting live on the Worldwide Coalition Radio Network here at coalitionradionetwork.com. Facebook.com/the Coalition Radio. Facebook.com/the Coalition. On the mighty Twitter at Coalition_radio. And, of course, the mothership, coalitionradio.us. We're going to sign off for now, but we will be back later on today. We've got a full slate of guests scheduled for this evening to talk about, well, everything. We've got a small businessman from Warwick, Rhode Island, talking about what it's like, the challenges faced, and the opportunities given for working your job and still punching a clock, if you will. And I say that loosely. I'm pretty much sure if he's awake, he's working. And then later on tonight, we'll have one of the folks competing nationally for the Libertarian Party platform. Tomorrow night, we'll have a rather provocative guest. She's actively involved in the Libertarian movement. She runs the Orleans, New York Libertarian Party chapter. She is also very recognizable as someone who's intimately involved in the sex workers industry. She's a dominatrix. We'll have Chase on tomorrow night. Friday, Paul Roselli, another frequent offender, rejoins the Coalition to talk about the environment. We'll have a full Friday evening of scheduling. And, of course, many times in the evening, we'll have open mic. Call in 401-205-3738 and opine in a way never thought possible here in Rhode Island media. We abhor the tyranny of the mute button. We respect our guests. We give you an opportunity to develop your point. Most importantly, it's a forum for which issues can be discussed in new and provocative ways. Folks, stay tuned. We'll be back soon.